Does the spinal cord impact epilepsy and related disorders? Does the spinal cord have any influence on epilepsy and related disorders? This is a fascinating question that touches on the complex relationship between the brain and spinal cord. While epilepsy primarily arises from abnormal electrical activity in the brain, recent studies suggest that the spinal cord can play a significant role in seizure activity. Research indicates that spinal cord stimulation, a technique that involves sending electrical impulses to the spinal cord, may affect seizures. In experimental studies, higher frequencies of spinal cord stimulation, particularly between 130 and 180 Hz, have shown promise in reducing spike and wave discharges linked to seizures. This suggests that the spinal cord might help modulate seizure activity. However, it is important to note that lower frequency stimulation, around 30 Hz, could potentially worsen seizure activity. This highlights the spinal cord's complex role in managing seizures and how it interacts with brain activity. Moreover, spinal cord stimulation is being explored as a potential treatment for epilepsy. Some studies suggest that it may influence inflammatory processes involving glial cells, which are crucial in the generation and propagation of seizures. While these findings are promising, the exact mechanisms by which spinal cord stimulation affects epilepsy are still being studied. On the flip side, severe epileptic seizures can lead to changes in the spinal cord itself. In animal models of temporal lobe epilepsy, researchers have observed that seizure activity can cause spinal cord injuries. These injuries may include neuronal damage, disruption of the blood-brain barrier, and inflammatory responses. However, it appears that the damage to the spinal cord is less severe compared to that in the brain, and such injuries tend to occur mainly after intense seizures. In summary, while epilepsy originates in the brain, the spinal cord can influence seizure dynamics and may also sustain injury from severe seizures. This dual role makes the spinal cord an important area of research in understanding and managing epilepsy and related disorders. It is crucial for individuals with epilepsy to have thorough neurological evaluations and consider emerging therapies that target spinal cord pathways. However, all treatment decisions should be made in consultation with healthcare professionals who specialize in epilepsy care.